Hi, everybody. Thanks for joining. We're going to start at about 12:16.
LJ, the room is slowing down with people joining, so you can get started whenever you're ready.
That's perfect. Thanks so much, Gina. So I'm sure you're all looking around the screen and thinking, where is Chad? And so I have to say that our fearless leader is not able to join us today. So you have me and Renee and Jana to guide you through current status and situation. I think our reporting time is going to be relatively brief on some new items and just updates, and then wanted to leave time for questions from all of you. So starting right out from the beginning of this, I want to say that I think we have some good news to report. As you've seen, any of you who looked at the New York Times or any of the other information that's being shared through the news, we definitely are seeing a slowing down in terms of case rates and hospitalizations related to Omicron. That is true for us here as well in Monroe County. Hospitalization does remain steady, but the new case incidence is falling, and we've now had 4 successive days of declining new diagnoses in a row in terms of the diagnosis rates. The projection is that hospitalization rates and census will fall in the coming days. And I think that just is just nice to take that in and say, let's hope so. Chad, what the actual heck? Sorry, everybody. I just saw the person who wasn't going to join us has joined us. So like, dude, unmute and talk.
I'm dying horribly.
I didn't disclose why you weren't joining us.
Oh,
I didn't say you were dying, but go ahead. You HIPAA, man, like you.
Okay. Oh no, so I have COVID, everybody, yay. So in honor of the COVID call, I decided why not get COVID just to celebrate the whole 2-year nearly anniversary. And turns out Omicron must be really infective, because even when you don't leave your house and wear an N95 24/7, it still comes and finds you. So needless to say, thankfully, I am actually pretty good. So other than sounding, I keep saying it's like I'm going through puberty again and hung out at a rock concert all night long. So other than that, and my voice probably cracking out, and I probably will try not to talk that much because I don't do a very good job at it. Other than that, so far so good. So glad to join. And sorry that I still have my Christmas tree up in my office.
You are cracking me up. Do you want me to go forward with your little summary report, or would you like to do it yourself?
Sure, feel free.
All right, well, feel free to add some color commentary along the way, because that'll make it far more entertaining for everyone and more informative. So just getting back to where our cases are in Monroe County. Yesterday, for January 18th, there were 1,237 new cases reported, and our 7-day rolling case positivity rate is at 17.5%, which is down a little bit from where it was previously. So again, moving hopefully in the correct direction for all of us. Wanted to just update you all around the ordering of home antigen tests for anybody who was online and looking at this yesterday. There was a beta test, or quote unquote false start. of home ordering for antigen tests. Is 4 antigen tests per residential address that people can order. It went live yesterday, though it wasn't supposed to be live today. It's officially live today. And Renee, I think you actually went online to do this. You want to tell people what they do and what happens?
Sure. I went yesterday to the covidtest.gov website, and it wasn't active. But my daughter found a link to the US Postal Service, where actually when you go to covidtest.gov, the link sends you to the Postal Service. And that was the link that was live yesterday. So everything's all put back together, but I managed to sneak in early and put in an order. So
fine work. So encourage your patients and families to go ahead and order those tests. Along the lines of other governments work in this space, President Biden is releasing 400 to 500 million N95s from the federal stockpile for distribution in schools, federal health centers, and health departments. So that should be coming soon. We also know that the home antigen test orders from the federal government doubled from 500 million to 1 billion. So trying to be responsive to the dramatic need for testing. And the other things that are changes in chat, I'm going to let you unmute and just discuss this because I think you're even more familiar than I am, is just the changes and the guidance around mandated boosters for healthcare providers. I'm wondering if you want to talk about that.
Sure. So we are still waiting for guidance from New York State about the exact timeline of when they have to be meeting this mandate from the governor's office. There's been a lot of conversations both locally and throughout the state of the fact that the concern is that this can only hurt the existing staffing issues at the moment. And so, at least be generous with the timeline of bringing this into the fold. So both from the Department of Health and from the governor's office, all we have heard so far is that the intention is to still move forward with the mandate, but as of yet, I am not aware of a date by which everyone must have received the booster at this point. So, I think every hospital in the region is moving forward with standing up booster dose clinics, specifically for staff, trying to get folks boosted and vaccinated as quickly as possible, because we do anticipate the mandate will likely kick in within the next couple of weeks. But as of yet, do not have any official guidance, nor do we have any timeline of when they will be releasing that guidance at this moment.
Thanks, Chad.
Yep.
In other updates, we just wanted to highlight that there are some updated visitation guidelines for Strong Memorial Hospital. They are temporarily adjusting visitation in response to the current community COVID surge. And so, and especially while the ED and hospital volumes still do remain very, very high. So starting this morning, actually at 8 a.m., they have shifted to a 0 visitation in the ED area. And patients in most parts of the hospital will be allowed only 1 designated visitor throughout their stay. The hospital teams have been very responsive to adjusting that visitation policy as COVID rates fall and as the hospital census drops. So we'll obviously update you as we see changes coming forward in that, but wanted you to be aware. And then I think just thinking about state and county guidance and processes around COVID diagnosis, reporting, contact tracing, we just wanted to highlight again, we talked about this last week. The county and the state are not doing contact tracing at this point now. We mentioned this last week, but just wanted to emphasize it again. And that is, when I say the county, I'm saying Monroe County. We are still getting clarification of the other Finger Lakes counties, because some of them, while they have a reporting function on their website, similar to Monroe counties, some of them may still be doing some contact tracing and follow-up for COVID cases. So as we learn more about this from our colleagues at the Stay Tuned Network, we will share that information with you for those of you who are caring for patients in multiple counties. Again, as a reminder, if a patient tests positive, whether they test at home, in your office, or from a lab, the guidance from Monroe County is for them to go to the Monroe County website and to report that positive test. If it is one that they did at home, they have to take a picture of that home test and upload it. And then they can request an isolation order that automatically has release orders attached to it based on the 5-day isolation rule. There's also a button on the county website by which you can click to request a quarantine order as well that has the release dates in addition. Just as a reminder to all of our providers as you're counseling, particularly children and families with children about return to school, while it is a 5-day isolation rule, the goal is for kids to return to school with symptoms resolved or nearly resolved, resolving. We are hearing of a lot of kids at times going back, still quite sick, and the old rules hold true. 24 hours fever-free off antipyretics and with symptoms really improving. It's just important to educate families in that space. Wanted to then just following along with that, just share 2 resources for you all. Renee, this first one would be the return to play infographic. So again, the return to play guidance that we spoke about last week really is not related to infectiousness. It's related to inflammation and the body's response to that, and wanting to assess higher risk children in the higher risk groups, kids with moderate to severe symptoms, and kids who are 12 and up and competing in intense or competitive sports. This return to play infographic was developed and designed by the Schools Reopening Task Force in collaboration with parents. It goes further on this. We're just highlighting it. It will be in our messaging again today. It's on the webpage so that you can go to it with all the most recent COVID updates. If you'd like to share this with families, if you wanted to post it on your own website for explanation. There was a press release that went out by the Schools Reopening Task Force on Friday that highlighted this information and also highlighted the intent that this is to educate and provide the best care for children and adolescents in our community. Again, this is not a mandate. We know that there are lots of schools that are doing different things and families pushing back at times. We want you to have uniform information that you can share that supports the work that you're all doing when you recommend assessing these kids 10 days out from their diagnosis, and then providing either further assessment if it's required or instructions for them to be returning to activity. So I hope that that will be helpful to you and your teams. And then the last thing from me is that I think all of you are caught in needing to answer people's questions about isolation, quarantine, contact, everything. And so Renee, if you want to share, I said to somebody last week, it's sort of like a math word problem and they keep coming up. And so then I have to say, Brenda Tassini shared this with me. 10 years from now, there's going to be a standardized test with a math problem that says, and you can read yourself, but if Matt was exposed to COVID on Tuesday, had no symptoms 4 days later, then Susie got it. I just love this because I feel like this is all day long for you all and for us. And I never like math word problems. So when you reach out to me, if I don't answer right away, it's because I'm literally sitting down and sketching out what the scenario is. So I think we have a resource that might be helpful to all of us that came from New York State. Renee is going to share this with you. This is a chart and we're going to post it to the website. The Monroe County team has reviewed it and has said this is in accordance with the guidance that they're promoting as well. But I just want you to take a quick look at this and what it offers you. It offers you specifically information about quarantine and information about isolation too. There's 2 different parts to this. There's 2 pages, but it offers, there you go. It offers information about isolation on this page and goes through all of the details about that. And then Renee, if you want to go back up to the quarantine one for a moment, I'm not walking through the whole thing with you. I just want you all to know that this is there to help you translate your math word problems about COVID. Specifically, what I think is helpful on this particular chart, you can't see me pointing at it, but I'm pointing at it with my hand, is that it breaks it down by age group. And it also breaks down the differences between vaccination status with regard to quarantine. So I hope you all will find this useful. I can tell you, if you reach out to me with a question, I sure as heck have now got this beside my computer. And so I'll be using it to interpret anything that's not particularly straightforward. And so that was the end of what I have. I know that Jane is going to walk us through sort of what our most recent updates are on the website, I think. Is that right? So if you want to stop sharing that, Renee, we'll turn it to Jana. And then I see Dr. Elizabeth Murray's with us, and just will give Dr. Murray a chance at the very end to see if there's any new guidance she has for us around vaccine disinformation.
Before we switch to the website, there is a question in the chat that we might want to answer first. And ask, do individual practices have a responsibility to contact trace within their own practices? Despite the county not tracing, do we need to encourage staff to share their positive diagnoses with contacts within 72 hours?
I think, that's Dr. Francis, I just looked in the chat. I think that is really what is happening. I think within individual practices, people have taken it on themselves to do contact tracing among their providers and their staff. And I think that's really important for the practice, for your colleagues and for the patients. So yes, we would encourage for people to do their own contact tracing within their office setting. It is not going to happen outside of your office. So yes, thank you, Anne, for highlighting that.
And then a comment from Mendon Peds that Livingston County is no longer accepting at-home test reporting. They're directing people to the state site.
And so thank you for that, Mendon Peds. And what we are doing right now, as I mentioned, we are looking to see if there's some consolidated information we can share about what each of the county health departments are doing. Because there is not one uniform approach in this. So some may use the state reporting site, some are using their own reporting site. If you're not sure, if the question arises, I would encourage you to direct families and for your own staff to go to that individual county's website and see what they are doing at this point.
Yeah.
I'm sorry,
Okay,
it's
this
hard
is
to keep
Michelle.
tabs on that. Yeah, hi, Michelle, thank you.
Hey, just yes, that's true in Livingston because this new state guidance is pointing everybody to go to that. So our rural county health departments are a little bit in limbo, waiting. So yes, some still have theirs up and some are getting rid of that. Some are still doing test to stay, but I think that's going to go by the wayside too. But I had a meeting with them yesterday afternoon, and there's a lot of things in limbo right now, just based on what the state is doing and that they're getting rid of all their contact tracers. And it's just very confusing for everyone, including the LHDs right now. So apologies from them, but they're still trying to wade through this right now too and figuring out what's best.
Thank you, Michelle. We appreciate your work with all of the Finger Lakes counties and trying to help us understand where everyone is. And yes, I mean, I think as within the whole pandemic, I think we have to be patient with one another. Like everything changes every day. So one of the things I was going to say is like, here's the guidance for today. It could change again tomorrow. It literally is changing by the day still. And so we will try to keep you posted as soon as we hear any particular relevant changes. Jana?
All right. So actually,
I'm sorry, there was one more question. I don't know if you saw
There
Dave
is.
Topa's question about
sorry.
if we report to eClears, do our patients still need to register at that county site?
Yes, I'm going to say yes, because the reporting to eClears just is reporting on the test. It doesn't do anything to generate a release order, isolation and release order. This is that isolation and release order, or the quarantine and release order. That's your patient's ticket back into school. They have to show that to the school nurse. So it's really important. And if you have families who are having difficulty accessing that or unable to, offering whatever support you can is important. The other resource I would just add is families can call 211 for assistance in reporting. So for example, if somebody doesn't have access to the internet, can't get online to be able to do this, they can call 211 for assistance with reporting.
all right. So I am going to share my screen actually, and Michelle was asking where you can find that graphic, and this is where. So if you go to our AHP site, There's this little box that pops up in the bottom right corner, and this will take you to all of our current COVID-19 return to school information. And this first post is actually that return to play infographic. So you can go here and it'll open up a new window, and the graphic is available for download. So it has the press release and then the graphic is here. So you can download that as a PDF. In addition to that, we also have the new algorithms that the county has released. And so this will go over the 3 statuses. So student, teacher, staff member not vaccinated or not fully vaccinated. So that's, including the booster with a known exposure. Student, teacher, staff member who is vaccinated, fully vaccinated with a known exposure. And then lastly, a student, teacher, or staff member with no known exposure, regardless of vaccination status, if they are symptomatic. We're also holding any information about quarantine and isolation, so how you can access those sites. And this is where we're going to store the most up-to-date information. We are looking at this daily. And right at the top, we'll call out any of the new changes that are relevant if anything's been released. So that's what's going on with our site. That's all I've got.
That's great. Thanks, Jana. Dr. Murray.
Hello, I have Dr. Nicole Sifra here with me. She's an Allison Medicine Fellow and on Twitter, if you guys, another great person who spreads good information. No big changes in the disinformation that's out there. Still a lot of rhetoric about, the vaccine is not working and it's not studied in kids and kids don't get sick, which of course we know that's not the case. About almost 1 million pediatric cases in this past week nationwide. I do want to point you to some other helpful resources. The Children's Hospital is in the process of really pretty dramatically overhauling the COVID resource page. So if you just Google GCH COVID, it'll come up. And so it has links for available vaccines, but there's also the information sheet that goes through the questionnaires before you can get vaccinated and all of the general information about it. But there's a couple of different links for Spanish speaking families. There's and the for us, I'm sorry, that's not the right phrase. It's, what is it called? It's the conversation between us, about us. So these are all sorts of videos and information for Black families. And then there's all sorts of information for Spanish speaking families as well. So videos, and it's all vaccine specific. And so it's really, they're very well done and they're current, which is nice. So the next thing that's going to be updated is we're working on either a Facebook Live or some kind of interactive discussion with some of our maternal fetal medicine colleagues to address some of the fertility and pregnancy with vaccine concerns. Thank you.
I would just add that the page that Jana put up right under that summary at the top of our return to school archive, there is a link to the website that Dr. Murray just referenced, to the Golisano COVID resources for families.
Excellent. So I'm looking in the chat. Thanks, Dr. Murray. Thanks, everybody. I'm looking in the chat just to see what other what other questions there are.
Got a question from Dr. Cordero. There are more questions than ever about return to play. And with schools saying they only want full clearance, could LJ please give us some guidance about how to deal with return to play?
Yeah, this is a mess. That is an understatement. So what I can say is the press release and the infographic definitely refer where the guidance is. It is a small subset of kids for whom this return to activity guidance applies to, right? But the pushback seems to be now from athletic departments and directors and parents who just want their kids to just launch right back in immediately. So quite honestly, guys, this is clinical guidance. This is AAP guidance. We've reached back out to the AAP to say, is there data to support a change in this timeframe? Because there has been nothing new that's been put out by the AAP. So we have reached out, we have asked that. And quite honestly, I think this is not unlike, it's a little bit like the concussion clearance, right? I mean, how much pushback did we used to get about, waiting on concussion clearance? I think you're offering your medical advice in a particular situation. We know that the vast majority of these kids will be able to get back in very quickly. That return to play timeframe is really if anything, it's a reconditioning. You're bringing them back in a little bit more gradually to intensive sports. That's not just exercising for 30 minutes. It's not just going for a brisk walk. I mean, these kids are launching into, they're lifting or they're doing intensive activity. And I don't know how to convey it any way other than I had my adolescent had COVID last week, and I watched him he's not an athlete, so because he's injured right now, but I watched him try to jump right back into riding an exercise bike for 30 minutes. And he got lightheaded within 10 minutes. Heart rate was up. It wasn't his normal response. Do I think he had myocarditis? No. But do I think he needed a little more of a gradual return into stuff? Yes. So I think it's just trying to be smart about things for our kids. And you cannot legislate that the school has to do one thing or another. We can't do that. You can give your medical advice to a family and explain why this is your recommendation. And so there's going to be variability among providers too. This is just what this is. So my best advice would be to utilize, if it helps you, the press release that went out that explained what this is all about. Utilize our interpretation of the AAP guidance is actually, we've actually made it less robust. The AAP guidance still refers to every kid, all activities. We've really tried to hone in on the potentially highest risk groups. So that may not be enough to help, but I'm reading in the chat from Mendon Pediatrics that now every district is doing something different. This is not a place where we are aligned any longer in any way. And it's not new guidance. There's nothing that's new. If anything, we've again narrowed the scope of who this applies to, but it's the sheer numbers of kids. And that's where all the pushback is. And everybody's exhausted. So I think we just have to try to do the right thing by kids. And what you're really trying to do is make sure that those kids who might have more risk of having difficulty, of having had inflammation or needing a little slower return, are having an assessment and then some observation while they get back into that activity. Sorry, I feel like it's become a it's a four-letter word that's turned into a three-letter word right now. Like that's how much nonsense there is about this, but it's what we do, right? We were supposed to deliver the best care and anticipate and be protective and educate our kids and families. So if other people have any suggestions in that space, please feel free to add to that. I do know that Dina Faticone from Common Ground Health, along with Stephen Schultz from Rochester Regional and George Porter, all were interviewed on WXXI today. And so there will be more information out on WXXI on this particular guidance. And so again, hopefully a little more education. So with that, are there other questions? Did I miss anything else that was in the chat? Chad, what's the good word with that poor hoarse voice of yours? I'm so impressed that you showed up for this with your Christmas tree.
Honestly, it's either sit and stare at myself in the window all day long or actually sit here and stare at you guys. This is far more fun than what I have been doing. I'm going stir crazy. It's been 24 hours of isolation and I'm already ready to jump out the window and just run down the street and lick people. So stay away from my neighborhood.
24 hours with no human contact. That sounds amazing.
What I keep saying is the worst thing now is my wife has now started complaining of a headache just in the last couple hours. And my youngest woke up this morning with a sore throat. So I'm like, at least if I'm going to isolate, I didn't want to isolate with all of you. Like I could have had the house alone or something, but like, this is like vacation again. This is why I go to work. What are we doing?
Oh my goodness. And on that really happy note, I think we will wish you all well. We will send out further updates. If you're looking for the latest, go to our webpage and click on that little moving, what is it called? The little moving box that says COVID updates. You will get those in real time. So thanks everybody and have a great day.